We're on.
Oh, wait, sorry, got a little cut off there. We just get excited talking about taxes and things like that. We were just looking at this paycheck and all the deductions that you're going to end up paying on your paychecks. So we were this particular example, the person made $1,725, but they're only bringing home just under $1,300. So that means that over $400 of this person's paycheck, instead of going to them, is going to go to the government or to their union. If this person lived in a country with a conservative or Republican government, they would probably see these totals go down. They would see their net pay go up. If they lived in a country with an NDP government, it would be the opposite. They probably increase these. So people like social programs, and then they pay for them, and maybe they don't like them quite as much. It really kind of depends on where you are on that political spectrum. If you think it's worth it, then you're happy to pay it. If you don't, then you wish you didn't have to pay it, and you're going to vote for somebody else in an election.
All right, next up we have healthcare. Something that we get to enjoy here in Canada quite a bit. I, for one, am really thankful that we get free, and I say that in quotations, healthcare. And for example, here, guys, it is the largest and most expensive social program by far. So, here's a loonie, looking a bit different. It's actually kind of like a pie chart because it kind of shows you where all the money goes to when it comes to taxes. And this is from 2019. This is the federal and provincial governments will spend a staggering $264 billion on healthcare. That is a lot of money that is being put into healthcare so that we, as citizens, do not need to pay for it. And I'm sure that we all have some pretty good stories about that. I mean, for example, like when I had to go to the doctor and just get a prescription for medication, it doesn't really cost anything. And I'm pretty fortunate for that. Alberta's government, for example, is spending $20.6 billion in 2020 on healthcare. It's also another good thing, especially with today's climate, with the pandemic going on, that, again, speaking of personal experience, I'm pretty thankful that you're able to get testing on demand. Okay, it's not like in the United States where there was a huge problem because medical insurance companies wouldn't be covering the medical costs for getting tested for COVID-19. But here in Canada, and especially in Alberta, if you have any signs of symptoms, you can just go get tested without any question. You just phone number, and it's a pretty quick process, and it's easy enough to access. And a lot of that is because of the funding that we put into the healthcare system.
Can you just go back to that slide for 1 second, Mr. Yeoman? I just wanted to point out one thing too. If you look at this loonie, this, like Mr. Hansen said, this is what the government spends. This whole half, from like the middle to the right, all of that, elderly benefits, employment insurance, children's benefits, health transfers, social transfers, all of that is social programs. So if you look at the federal budget, about half of it is money to help Canadians. So if you say if we got rid of those, we would save a lot of money. Just to put it into perspective too, the Alberta government spends almost $21 billion on healthcare. Education is also a very large social program, and the Alberta government spends $8 billion on education. So that should help put that in perspective. When you think how many schools, how many teachers, how many students, that's $8 billion. Healthcare is over double that. So it's extremely expensive.
Just to add to that, it's important to note that healthcare is paid for by provincial governments, not by the federal government.
Yeah, they send some money to the provinces, but a majority of it, is paid for by the provinces, yes.
So, what do we get for our money? Like I said earlier, we get free, in quotation marks, universal public health care. So, like I said earlier, when you go to the doctor, you pay nothing. Okay? If you compare it to the United States, I'm sure you can actually look at some photos and you can see the horrors of someone needing to go to the hospital and pay thousands upon thousands of dollars for something like a broken arm. In Canada, when you go to the hospital, if you broke something, hope you don't, you get to come out with having not to pay anything other than time.
So a few other terms. Yeah. Go ahead, Mr. Yeoman.
No, I'm just going to say, so what does that mean? What does that mean to compare the Canadian system with the American healthcare system, right? In America, they have an insurance-based system, which means you pay monthly for insurance. Then when you get sick, you call your insurance company, and hopefully they pay for your healthcare. You usually have to pay a deductible, which is like a down payment on that. And the deductibles can be, depending on your health situation, can be quite high. So let's say, for example, in Canada, you're paying income tax. Let's say your income tax works out to about $500 a month, maybe towards healthcare. Okay, depending on how much money you make. In the United States, you might be paying $500 to $1,000 a month for your insurance premium, and then when you get sick and need, say, a surgery, you may have to pay $15,000 to $20,000 to get that surgery.
Yeah,
which you wouldn't have to pay in Canada.
Yeah, and then we'll talk more about that later. But the problem too with that system is that those are private companies. They're for profit, and they don't make profit if they pay your insurance claim. So they don't want to pay. You might think, oh, I'm covered by insurance, but then when you need it, they might not pay for it. So we'll talk more about that after. I just wanted to go over a couple terms. Hear these free healthcare. Again, it's not free. You pay for taxes, but you hear terms Medicare, publicly funded. You hear in the United States, the big thing is Medicare for all. That's what they're like. Medicare is universal healthcare coverage. There's a few more there if you just want to click ahead. You have universal coverage. You have single payer system. A single payer system means the government pays for your healthcare. Some countries have a dual or two payer system where the government pays for some, private companies pay for others, but Canada is a single payer system. We're also called a single tier. There's only one level of healthcare. It doesn't matter if you're a billionaire or a homeless person, you get the exact same quality of healthcare. And that's part of the key things to this is that healthcare is a human right. Everybody gets the same quality of healthcare. It shouldn't matter how rich you are, whether or not you get a good education or good healthcare system.
Right, as opposed to, for example, I know the Conservatives here in Alberta, they want instead of a single tier, they want a two-tier system, meaning that there is a public system that anyone can get care they need, but there's also a private system where if you have the money, you can just pay for the care that you need and get it right away. Let's say, for example, many seniors, for example, need hip replacements. Okay, there's a long wait for a hip replacement. It's like 8 months right now in Canada for the surgery for a hip replacement. In a two-tier system, if you had, let's say, $20,000, you can pay for the surgery and not have to wait 8 months.
And that sounds great because that means there's one less person in the public system. That's the whole argument behind two tiers. The people that can afford to pay it, they go to the private clinics, which means the wait list for everybody else is shorter. The reality, though, is that means that a lot of doctors are going to go to the private system, which leaves a lot less doctors and a lot less money in the public system. So the quality of care for all of us who can't afford a $20,000 whatever goes down. So, and then it's like, if you're rich, you get good health care, everybody else doesn't. That's kind of it. The right says it's a good thing. Conservatives, Republicans say it's good. The left, Democrats, NDP, some liberals, they say it's a bad thing. So this guy, who I'm sure nobody recognizes, his name is Tommy Douglas. He is one of the greatest Canadians. They had a competition about 10, 15 years ago, and he won it. You know, he was up there with Terry Fox and John A. MacDonald and those kind of guys. He is the person who is responsible for Canada having a public healthcare system. Tommy Douglas is the reason why you can go to the hospital and not need to bring a credit card or pay with money. He was the premier of Saskatchewan, so I know something positive came out of Saskatchewan. He was the premier of Saskatchewan from 1944 to 1961. He brought a lot of social programs to Saskatchewan, and the most important one was public health care. And it was a big fight. People did not support it in the beginning. There's a video on our parlay about Tommy Douglas. You can go read about him, which I would encourage you to do. He had a big fight on it. He is the one but he did bring it in. He won. He got universal coverage in Saskatchewan. So if you had to guess, little test question, which political party does Tommy Douglas belong to? What do you think the answer is? Okay. So what do you think? Is he a conservative, an NDP, or a liberal person? I want you to think of that. And what do you think? What is he? He is a member of the NDP. He was also in the political party called the CCF, which was the Cooperative Commonwealth Federation, and that turned into the NDP. He was the first leader of the federal NDP party. So he was when he was Premier of Saskatchewan as the CCF NDP, he brought the healthcare to Saskatchewan, and then the Liberal government of Lester Pearson kind of stole the idea and sent it to all Canadians. So Tommy Douglas is the reason why we have free healthcare. So you can thank Saskatchewan and Tommy Douglas when you go to the doctor. You don't have to pay. So we've already talked a lot about private versus public healthcare. I'll let you take this, Mr. Yeoman. You're already chatting about this earlier.
Yeah, so you were saying about this. Americans, they have an insurance system, which means they pay monthly for it. Usually you would buy the insurance when you're young and healthy, right? Because insurance companies, they will pay out, but they also think about risk, right? So if you call up an insurance company and say, hey, I'm an old man and I have a failing heart and I'm probably going to need a triple bypass heart surgery, the insurance company is going to say, sorry, we're not going to do business with you, because that would just mean they're going to have to pay a lot of money, right? And so typically in America, you have to buy insurance when you're young and you're healthy, and then you have to pay every month for your insurance and never let the insurance lapse, or you could end up losing your claim, or losing your policy. If you have a condition, like let's say I bought health insurance and I'm young and I'm healthy, and then when I'm 45 years old, I have a heart attack, but I'm fine, I recover from the heart attack. And then 5 years after that, I lose my job and I stop paying my insurance policy. And then I don't pay insurance for a year. And then after that, I get a new job and I want to buy insurance again. And they say, well, you had a heart attack before, so we're not going to cover you. Or they might say, we'll cover you, but the premium, which is the monthly payment, the premium would be $5,000 a month. Well, you can't afford the premium, right? So it's an insurance-based system, but it's designed for the insurance companies and for the healthcare providers to make profit. And one of the main ways in which they go about making that profit is from denying people coverage, denying people access to surgeries and medications that they need to survive.
Yeah, one of the complaints about like the public system in Canada is that there's long waits. Like Mr. Yeoman said, 8 months for a hip surgery or a knee replacement, and if you want an MRI, sometimes you have to wait a long time. Whereas if you want to pay for it, you can get it right away. But if you have insurance, those insurance companies don't want to pay for you to get expensive tests. So it's not hard to find examples of people in the United States that needed a test that the insurance company said, nah, you don't really need that, and then they don't get the test because they can't afford their own, and then they get sick. So would you rather wait and get something for free, or have to fight with your insurance company and end up getting it denied?
Or as in many cases, like let's say you needed a surgery, like I need heart transplant, or not heart transplant, but like I need, some kind of heart surgery that I need to survive, right? Well, the surgery, my insurance company denies my claim, so they won't pay for it because I didn't tell them about something before, a pre-existing condition. And so now I have to pay for it myself, and it's going to cost me $200,000. Okay, so now I have to sell my house, sell my car, file for bankruptcy, all in a hope to collect enough money that I can pay for the surgery I need, right? Canadians do not live with that fear. And trust me when I say this, many Americans live in fear that if they have a serious medical episode, that they'll lose everything they have because they need to pay for it. Versus in Canada, with our universal healthcare system, no one ever lives in fear of getting sick. Yes, we talked about that. 30 million Americans have no insurance. This is another problem, right? Millions of Americans are wandering around with no insurance at all. So what happens? Let's say you're a healthy young individual and you get in a car accident and you need major surgery, right? When you're done and you go to leave the hospital, they send you a bill for sometimes hundreds of thousands of dollars. And you say, well, I can't pay for this. I don't have any money to pay for this, right? That bill, you'll have to file for bankruptcy. It'll ruin your credit. You won't be able to buy a house or buy a new car. So it's kind of this great example of social programs, right? Because if you have a universal healthcare system, people overall save tons of money. Why? Because in a private healthcare system, sure, you didn't have to pay any taxes for 20 or 30 years. That was great until you finally got a bill for $300,000 and now you're completely bankrupt, right?
And I'm just going to interject here because we have like 8 seconds. So tune in for the next part of our video.